I remain positive by, I think, number one, having a great support system, surrounding myself with people who have the same disease. I found, I'm like them and I'm going through similar things, so it's, when we're fighting together as a team, it makes it a lot more powerful, and it's helped me a lot.
I stay active. I walk 5 miles just on my job. I swim. I also have a trainer, and I work out twice a week that way.
It's really a partnership between the physician and the patient. The physician won't know what to do unless the patient is able to communicate to him or her what's been going on in their lives.
The best way to communicate with my doctor is to go in there prepared. He asks me a lot of questions, so I have a lot of questions that I return back to him. And I also document a lot of the things that have been going on with me recently. So when I go in there, I can tell him, this is what's happening, why is that happening, or can you help me resolve some of these issues I'm having, whether it's with medications or with the disease itself. Going in there prepared and asking the doctor questions, asking him everything and being honest with him about what's going on, whether I'm drinking with this medication or not, things like that. You want to be as honest as you can be, and that communication, that two-way communication is very important.
I think that the best thing for anyone is to really do their own homework and do their own research, because then you're going to know the right questions to ask and have the correct answers given to you, rather than just blindly going into the office and having a doctor dictate to you what they recommend. You can be an actual active part in that team, and I think that overall you benefit in better health care.
The advice I would offer to someone diagnosed with RA is to get as much information as possible, to contact different resources, to find different resources, and to find other people that are going through the same challenges as they are, to really understand what's going on with them and to ask questions. You can never ask too many questions, whether it's with your nurse, your doctor, the front staff at your doctor's office, people that people in your community. You have to ask questions to understand the answers.
I would try to stay as positive as I can, because years ago the diagnosis was much more severe. Now you can do things about it, especially with the drugs that they have available now. Stay as active as you can. Sitting is not going to help because it plays with your mind also. Stay as active as you can. Try to keep your lifestyle as similar as it was prior to being diagnosed.
Making sure that they're exercising, they're eating well, that they're finding ways to manage their pain, that they're changing how they do things, and not worried. And don't worry about the fact that you can't do something. You'll get to be able to do that again. There was a time that you couldn't keep me off a golf course, and I couldn't golf anymore, and now I can, because there is hope for this disease.
I think it's very helpful in allowing patients to organize their thoughts and their questions, because a lot of the important points about RA are mentioned in the kit, which they may not know to ask these questions when they come into their doctor's office visit. And it kind of helps guide them along in the pertinent questions and issues regarding their RA.
I really like the part where it said to talk to your friends and your family and let them know what you need. It took me a lot of years to do that.